Hiya, I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. As you know, with this COVID outbreak, there are many things that are changing. One of the things that has changed would be private obstetric care. So recently, as you know, there are many things that's ongoing, and as obstetricians, I've been discussing with my colleagues on what model should we use to provide a high quality of care for our patients. Some things we agree on and use the same approach, but there are a few things that we do not quite agree on how do we provide the care. So I'm trying to go, I've made a list, so I'm going to go down the list and talk about what would be involved. Um, Now, that's a disclaimer I have to make. Things are changing. I think I'm optimistic, and I think the numbers are encouraging in terms of flattening the curve. But that's another topic. Now, back to I digress a little bit. The disclaimer is because there are changes every so often. Could be every day or every week. The things that I mentioned here sometimes could be outdated within a short period of time. Right, without further ado, the number one topic I'm going to talk about is the length of clinic. Because of social distancing, what we all agree on is to try to prevent too many people in the waiting rooms. So there are different approach. Some of my colleagues doing clinic, they um, use a very strict approach to say, look, all patients should only have 15 minutes. Then after that, you have to leave the rooms, you have to leave the clinic. So everything is pretty fast paced, and eventually you're cutting short the time to see your patients and explain things. Um, I use a different approach actually. I actually prolong the clinics rather than shorten it, um, because I find by prolonging the time between patients, I have time to explain things, reassure my patients. Some of it's I can imagine some of us have a higher level of anxiety and worry at this time. It is totally normal to have this feeling. But yeah, I do spend longer time between my patients so that I have time to, when they leave, there'll be some time before the next one comes in, um, and also have time to clean the rooms. Um, and also, if there are extra times, I use it to discuss a few things, which I'm gonna go down the list. We will discuss a bit more what things I'm spending more time to explain to my patients. So yeah, for me, I prolong my clinic. So there's knock-on effect on my practice in a way that it's quite busy now. And what I do is I am my secretary. Thanks to Natasha, who is willing to open up more clinics and help me spend longer times in our clinic to see my patients. So that's my choice to spend more time in the clinic. Secondly, is partners. There are some hospitals in Perth and in other states who actually ban any partners from going into the hospitals when patients laboring. I think that is a big, very huge impact because partners are so important during labor. So far, the hospitals I'm working with, St. John's, Mount Lawley, and Subiaco, the partners are still, of course, they say look one partner, but partners are still allowed in the to be with the patients in the hospital. Thank God for that. And my clinic, I've heard some of my colleagues discourage or could be strongly discourage partners from attending the clinics with them. At the moment, of course, we try to reduce the number of people that we have contact with. But many of my patients would actually really prefer their partner there to provide support and to help them ask questions, think about questions, ask and take down notes in case there are things that they forget. The partner can remind them. So yeah, I think look at the moment as it stands, my clinic, I think partners still a very integral part or very important part of the consult. So I leave it for my patients. I do tell them, look, limit the number of people coming to the clinics, but if you have someone you think important to come with you, then yeah, bring them in to the consult. Number three is the antenatal classes. As we know, most hospitals, all the classes have been stopped. And that create a little bit of worry, especially for first-time moms. They would like to know more about the process of labor and what's going to happen, and pain control, looking after babies, breastfeeding. There are a whole heap of things, relaxation technique during labor, etc., etc. So the hospitals are proactive. They are currently doing their online resources to provide to patients. I heard Subiaco doing providing slides and sending by email to patients with the information. Mount Lawley, they have live session. I think there's one session on Thursday. You can check out the Mount Lawley Instagram and Facebook to find out. On top of that, as mentioned, I do spend more time. This is one of the things I spend more time with my patients to go through a few things, which commonly ask about things that happens when they come into family birth unit, and after during labor, delivery, and after baby is being born, etc., etc. So I do spend more time in my clinic to explain things. So if they come in their appointments, each appointments I spend even 10 minutes extra to explain things. Cumulatively, they have got hours extra in learning those things to replace the clinic. On top of that, I think, look, in the digital era, in my last video and my last Facebook post, I bought a set of online classes. It's called Yogi Birth. I've spoken to the founders, once again, Laura and Tom. I think we get along very well with each other. Yeah, in that app, it'd be very useful. I give it to all my patients from 23 weeks onwards of pregnancy. They get online access for 3 months. From there, you can learn yoga during pregnancy, meditation technique, relaxation technique during labor, and there are classes for antenatal, so-called antenatal classes with information and postnatal support. So yep, use of digital resources. So take antenatal classes. The fourth thing affected will be the glucose tolerance test. As we know, in Australia, different countries have different criteria. In the UK, last time we only do the full set of glucose tolerance test. That means that glucose tolerance test is a screen for diabetes. We do it in pregnancy, and basically you have to go fasting in the morning. You get your bloods checked, and then you get this big sugary drink to drink, and then you get your blood test done 1 hour later, and then also 2 hours later. So it's a process. You're in the lab for a couple of hours, or you can leave and come back to the lab, but it involves a couple of hours of interactions for this blood test. In Australia, we screen everyone. Some pregnancy higher risk, we do it twice, otherwise you have at least once. In UK, they don't do it for everyone. They do it for higher risk patients. Otherwise, you might take a fasting blood glucose as a screen to see who actually needs glucose tolerance test. There are pros and cons on which way we go for. How strict are we? Are we going to miss anything? But at this stage, with the outbreak, many labs are closed, and we're trying to avoid too much interactions unnecessarily. So recently, the OGTT, the glucose tolerance test. There's a guidelines or a change to say, look, why can't we use the more lenient approach, more like UK style, not to do it for everyone? I'm looking into this. I think, look, as it stands, I mean, for once, number one is many labs are closed. As a first instance. So yeah, perhaps we switch to the UK style, and then we go on and see what happens over the next few months. So OGTT may be more selective in this day and age, in this outbreak period of time. So OGTT tick. Number 4, I talked about it in the past, is costing. Everyone gets hit, I think. I've just spoken to a lawyer recently who have just mentioned to me that her pay got cut from the company. So I think everyone is affected with this economic downturn. As mentioned, at the moment, I do a few bulk billing clinics at the beginning of my antenatal sessions. I'll keep going for a few months and see. As mentioned, we're all trying to bear this burden of costing. So we do what we can. But for more details, have a look at my website and my Facebook. Oh, my glasses keep going slanted. I think I need new glasses, but hey, the last thing, we are not ready to go to the optician at the moment. Yes, costing as mentioned. For full details, look into my website and my previous Facebook posts. So that's about it. A few things that I've mentioned there as a summary. At the end, it's still very important to maintain a very high standard of care for all my obstetric patients. I don't want to rush. I want to make sure the baby is growing fine, make sure that we don't miss any little things in my obstetric care. So feel free to let me what you think. If you have other experience, then you can put in the comment section, and it's nice to discuss things like that. Okay, that's it for now. Goodbye.
That's the end, everyone. Stay safe and healthy. Bye-bye.